Hi, my name is Jasmine Mondragon, and today we're going to be talking about how to eliminate stigma within the work setting and clinical setting, specifically towards or against alcohol use disorder. And so, what is stigma? So, stigma is essentially a strain on a person's reputation, right? Therefore, it's devaluing of certain individual based on the characteristics that they may have. And if you didn't know, there's actually 3 types of stigma. So there's public stigma, which is discriminatory attitudes about mental illness, right? For example, if you're a potential tenant who's applying for an apartment and the landlord rejects your application because you have a mental illness, that's considered a public stigma. And then there's self-stigma, which is internalized shame or embarrassment of one's own condition, right? You're like, why is this happening? Why am I like this? So on and so forth. And then there's institutional stigma. So that basically is policies that are implemented by the government or private institutions, organizations that may intentionally or unintentionally try to limit opportunities towards mental health services, such as limiting funding that's about for research for mental health, or limiting mental health services in relative to other healthcare services. And as we will discuss how we can eliminate a stigma in a clinical setting, there's actually stigma in a clinical setting. How might that be? Well, unfortunately, some clinicians will purposely shorten their visitation times with a patient. It's not funny, but it actually does happen, which I did not realize. And if there's an individual or patient that has alcohol use disorder, which is the current substance disorder that we will discuss, they will use terms that are inappropriate and insensitive, such as alcoholism, and they will engage less and show less empathy for those with AUD or other disorders. And so stigma obviously is a negative. It's a negative situation that occurs and surrounds an individual. And so in what ways can it manifest itself? It can develop into identity issues. It can show up as low self-esteem and shame. It can also make the patient or individual feel isolated and alone. And by that, for instance, if a patient has AUD and they meet with their therapist or their clinician, they may actually withhold vital information of how much alcohol they've consumed because they fear that their clinician will judge them, right? And so that allows and defers individuals from seeking further treatment that's actually necessary. And so, since we've already discussed stigma, what substance disorder are we discussing and looking on how to destigmatize in the workplace or in a clinical setting? So alcohol use disorder is a persistent pattern, right? A problematic persistent pattern that usually leads to significant impairment and can manifest in many ways, but it has to be at least 2 of the following. So it can be an intense craving or urge for alcohol consumption. Excuse me. Excuse me. A persistent desire or unsuccessful effort to cut out or control their amount of alcohol intake. Or it can be a recurrent alcohol use that actually leads to failing to perform successfully in everyday life situations, such as your home duties or work or school. And it's taken in large amounts over an extended period of time. So now that we know what alcohol use disorder is, excuse me, and what stigma is, how can we ourselves as employees, coworkers, managers, psychiatrists, psychologists eliminate that stigma against patients or individuals with such disorder? So we have to recognize how it presents itself physically. So obviously not every case is the same, but for this situation, we have an individual who's clearly distressed. And here we have a video that shows signs that employees who are participating in taking illegal substances such as alcohol for this case.
Of employees who
So we have here examples such as the first one will be absenteeism, which is being absent frequently, not showing up when you're supposed to, having workplace accidents, more frequent injuries that happen more frequently, mental health and illnesses such as anxiety or depression that may occur alongside the disorder. And so now that we know how it can present itself and how stigma affects an individual, how can we eliminate that stigma? So for instance, we must always recognize that addiction to a substance is a mental health disease. It's a mental health disorder. Recognize and acknowledge it and educate yourself about it. Encourage and offer supportive conversations, right? Make sure you're listening and understanding what the person or the individual is telling you. If you're a physician, listen and understand to your patient. They have their feelings and their stories to tell. Let them talk. Don't override them, and don't just assume or generalize the situation of what they're telling you. And be empathetic, right? Communicate resources and benefits. If you're an individual who has resources to certain programs that may benefit an individual who's seeking treatment or help or a recovery program, let them know that you have that resource or that connection, so that way you can enable and then you can actually be a part of their recovery. And remember, language is crucial when it comes to addressing mental illness. So if it's alcohol use disorder, use it as it is. Don't, instead of using alcohol abuse, alcohol dependence, or alcoholism. And if you're a psychiatrist or psychologist, how can we ensure optimal care and eliminating stigma at the same time? Remember, non-stigmatizing, encouraging language, understand what they're telling you, and let them explain, right? Encourage patient autonomy, explore patients' understanding of the disorder, right? Of their alcohol use and the consequences before even diagnosing them. And also, it's important to educate the patients that have alcohol disorder and, offer them evidence-based treatments. As we mentioned, language is key. So instead of relapse, you would say reoccurrence or return to substance use. No one's an addict. They're a person with a substance use disorder, and they're not clean or sober. They're substance free. So we're going to see an example of how a professional clinical setting should be within a patient and a psychiatrist, psychologist.
I don't think this is easy. I think you've been working really hard for a long time, and there's little steps that you have to take, and you have to set your plan. There's going to be slips. There's going to be triggers, and I think our work is to be always talking about what you can do when those triggers appear.
So as you can see, the psychiatrist was reassuring her that it's not, recovery isn't linear. Things might flip up, but that it's okay if she messes up or it doesn't go the way it's supposed to go to plan. But like I said, recovery isn't linear. But she's reassuring her that it's okay. It's going to be difficult. She's making sure she understands the process. She's going to guide her through it because, she's just trying to understand why she has to be here, why she's in recovery, and that she needs it overall. And so you're wondering, am I protected under certain regulations or laws? Well, if you're an employee with AUD, you are potentially covered by the ADA. So the ADA defines disability as a physical or mental impairment that limits major activities such as AUD. And so therefore you are protected by the ADA if you can perform the essential functions of your job. Now, if you're a current illegal user of a substance like alcohol, it's not protected by the ADA. However, if you're currently using alcohol, you're not automatically denied protection. Regardless of this, an employer, you may not at all discriminate against a person who has a history of such addiction to substance. And so how can you as an employee seek accommodations, help at a workplace? So first and foremost, please talk to your manager or your boss, go to human resources and tell them, hey, let them know that you need time off or leave of absence. But before you go into the situation about reasonable accommodations, mention that you need a time of absence or leave of absence, or you need time off. And then, propose ideas such as, modifying your schedule or becoming part-time from full-time. You may ask, is there the option to work from home, or is there reassignment or unpaid leave or sick leave, right? In case you're in the process of recovery or seeking treatment. And they should always respect your decisions. And remember, you are not alone. It's okay to ask for help no matter what setting you're in, and do not hesitate to reach out. Or, if you're an individual who knows someone who's struggling, do not hesitate to offer to help, even if it may not seem like they want it. And so if we ensure that these rules or these tips into an environment, we can ensure a welcoming, safe environment that eliminates that stigma, and we can function.
It's important to remember that showing empathy in this way is not a sign of weakness, and it shouldn't distract from the needs of the company at large. Listening to the needs of employees and acting in their best interest is one of the easiest ways to develop a positive relationship
without compromising a professional relationship, right? Without compromising that professional work relationship, we can ensure that we can help each other out by listening, empathizing. And as always, I will reinforce ways to reduce stigma, right? Be informed, educate yourself about mental health, and normalize having a conversation about it. Don't use these disorders as adjectives, and recognize that getting treatment, seeking help is normal, and obviously know that you're not alone, and there are various ways to cope and overcome stigma. And if you are someone that needs help or know someone that needs help, please give them these resources that are available for crisis hotlines, or there's the HASA National Helpline to call. Don't hesitate to reach out if you think you need help or you know someone that may need help. Thank you.